As we start this panel, this is our industry panel, so we're looking for perspectives from our industry members. What are they doing to address mental health? What can we bring to our students? And what do our students need to be prepared for when they leave our institutions? I've got about 4 or 5 questions that we're going to start off with here just to set the conversation. I'll let your brains get warmed up. They'll move into audience Q&A. If you don't want to raise your hand and ask the question, that's fine. We do have Slido being monitored in the back, so feel free to anonymously submit that question if you would like, and I'll have them wave at me to let me know that there's a question there. With that, we'll go ahead and get started. So for my panelists, can you please tell us who you are, who you're affiliated with today, and what do you do related to aviation mental health?
Good morning. I'm Mark Larsen. I'm NBAA's the Director of Safety and Flight Operations for the National Business Aviation Association. We represent the companies that use aircraft in furtherance of their business, but it may not be their primary business, such as an airline. In terms of my work with aviation mental health, I'm staff liaison to our NBAA Safety Committee, and within that we have a Fitness for Duty working group that our overall approach fitness for duty, considering things like air medical issues, fatigue, and then certainly aviation mental health really kind of being the 3 stools of, or 3 legs of that stool, excuse me, in our approach. So NBAA is working to further support the business aviation community from kind of a peer support perspective, and ensuring we have access to those resources, as well as educating our industry or segment of the industry on many aspects of mental health and how folks can work and support that from a company level all the way to the things they can do individually to take care of their own mental health as well.
Good morning, everyone. My name is Rondeau Flynn. I'm with the Allied Pilots Association, where we represent the nearly 17,000 pilots of American Airlines. And in my role today, I'm also the Air Medical Chairman for the Coalition of Airline Pilots Association, where this is a trade organization where we work on a lot of different issues for the airline industry, as well as our profession to make it better in Washington, D.C. So today I'll be speaking a little bit about peer support from our Allied Pilots Association, specifically for American Airlines, and then more broadly against the rest of the industry on how we do the work that we do. Thank you.
Good morning, everyone. My name is Jeff Horan. I'm with the NetJets Association of Shared Aircraft Pilots this morning. Currently a captain for NetJets, and I'm a peer support volunteer within our Health and Wellness Committee, which is our peer support volunteer program, and we have a bunch of other programs to help pilots. We work cohesively together, so I'll talk to you a little bit about how we run our peer support volunteer program, best practices there, and how you can utilize that as a line pilot or future, hopefully, pilot in the industry.
Good morning, everybody. I'm Andy Richards. I'm the Chief Operating Officer for Duncan Aviation's Michigan operations. We work on business jets, inspecting, maintaining, repairing, modifying. We have operations that I'm responsible for in Michigan, both at our Battle Creek facility just down the flight line, and then also at our Kalamazoo facility. We total about 800 team members providing those services to business aviation. As COO, one of my responsibilities is the health and safety of those team members, and we do a lot of different things to try and maintain that health and safety. Some of those are cultural, providing the right environment, and we'll speak more about that later today, as well as tactical, providing specific resources for behavioral and mental health for our team members.
All right, thank you for the introduction, and thank you for being here today. We're going to talk about kind of a couple different facets of the industry, but we'll start off with peer support first. We're going to talk about peer support with students next, but I'd like some insight into what your peer support programs look like and how things have changed in the past few years with the new regulations changed. Rondeau and Jeff?
Sure. So there's been a lot of changes. So kind of from a top-down perspective at the Allied Pilots Association, also known as APA, we have 7 different departments that work on peer support. First, our national committee, a bunch of leadership positions, and then below that are 6 specialized subcommittees. These are roughly 200 professional pilot volunteers, specially trained. And I'll just go through them very quickly. So first we have what's known as Project Wingman. I'm wearing a lanyard here today. This would be like our premier household name of peer support. Then we have our HIMSS program for addiction recovery. After that, we have our critical incident response program, where those are becoming more popular across many different industries. Excuse me. After that, We have what we call our scientific research arm of aeromedical, which is occupational health issues. Then we have our DPASC, which is also known as our LTD committee, and then our newest committee called our Sudden Grief Response Program. This has been just a phenomenal program. As you can imagine, when you go through grieving, bereavement, it takes a lot out. So we really look at the landscape of our occupation, of our pilot group, and we try and support wherever we can. And on top of that, we're attached to a professional medical department. 5 registered nurses, consultant MDs, and a neuroclinical psychologist, PhD. So we all work together. We have medical professionals and then pilot professionals who are trained in peer support. So it's a really unique collaboration, and it works very, very well.
Yeah, kind of piggyback off of what Rondeau said. So the NetJets Aircraft, or Association of Shared Aircraft Pilots, and NetJets have a what I believe is an industry-leading LOA. I'm really proud of that. That both company and union have an actual contractual agreement of buy-in on the peer support volunteer program and how to take care of your pilots and their mental health and their just well-being. Right, as we know, safety on the flight deck is paramount and priority. So being able to support our fellow peers in that manner is absolutely wonderful. So how ours is based, we have 12, we used to have 12, actually with the growth of our company, we're now, I believe, up to 14 peer support volunteers. We have a 24/7, 365 dedicated hotline that our volunteers cover and take care of. So any phone calls that come in, we're there for you. We also have a professional medical team on top of us as well, clinical psychologists, critical incident response team members that can help anyone that may need more than just that peer support volunteer conversation to happen.
So as we know, the aviation industry is broad in what it does. And so we understand that not every institution or not every employer is going to have the resources of, an airline or like what NJASAP has with NetJets. I guess Mark and Andy, would you be willing to talk about some of the unique needs of non-traditional aviation pilots and the other half of aviation, which is our, maintenance and management workers? What are some of the unique needs and what are you doing to address them?
Sure, thanks, Laila. So as I talked about these organizations that use aircraft in furtherance of their business in business aviation, many of them very small organizations in terms of their aviation function. In some cases you have the situation where it's the owner, the founder of the company that may be the principal operator of the one aircraft that they have. Perhaps other situations it's a single pilot or a couple pilots depending on the aircraft requirements for crew. And so when we look at our membership, for example, 60% of our members that operate aircraft just have one, and that number goes to 80% have one or two. So the vast majority of our organizations, it's a handful of people that are involved that would fundamentally be different than, let's say, a large airline that has lots of folks, and you can have a peer support program that allows that anonymity of what's going on and who you're talking to. So our approach is really to try and find a way to address that and sort of aggregate some resources here to help offer the same resources. As people, we need that help, and or we may need. And so how do we aggregate that to kind of meet that moment? We certainly do have larger departments, and some have found some other ways to bring those resources in, and they can go directly contract with that or engage that as well as one of the ways to support that. Certainly we see it within pilots, and over the approach of this too, we're trying to understand what it is, the maintenance, flight attendants, other ground support personnel, schedulers and dispatchers that are all part of business aviation operations as well too. How can we make sure that we're helping meet everyone's needs, and that's part of what we're trying to build out at this point too.
Thank you. So Duncan Aviation is an MRO. There are certainly stressors that you mentioned, Laila. When you're returning an aircraft to service after a major inspection, modification, refurbishment, your job is critical to the safety of the passengers and the pilots that are going to fly away with that aircraft. And so that can be very stressful in and of itself. And then also when you're doing that in a team atmosphere like we do at Duncan Aviation and other MROs, you've got that responsibility spread over several individuals. So what's really important in that context is to make sure you've got a culture that values safety and belonging, a culture of care, one that leads to that psychological safety, because human factors play a role in maintenance, as we all know, and we've got to be mindful of that. So how do you create this culture? You hire the right people, first of all, and that may sound really basic, but if you're trying to create that culture of safety and belonging, you've got to find people who are wired to be part of that. And not everybody out there is. So we try and be really careful about hiring. And then when you get those people in the door is, you train them on what you expect as we propagate that culture. And then probably the biggest part of all is the leadership. And so you have to provide the training to leadership in subjects such as emotional intelligence, so that they can identify when somebody's struggling, when somebody on their team is not feeling like they're being cared for, or they're struggling outside of work or at work. And they can identify that. And while they're not psychologists, definitely not psychologists, they're mechanics first and foremost, and technicians. If we can train them with some emotional intelligence training, they can help identify it, and they can then understand how important it is to be someone who listens. And that's the only job they have in this, is to listen. And then we tell them, okay, you've listened, here's some resources that are available. We have a few resources that are available. As the guys mentioned just earlier in the other question, we have an on-site behavioral health therapist, 40 hours a week, right over there, that our team members and their families, because it's not just the team members, right? It's also their families that impact how things are going. And so they get to use that for a minimal charge. And then also, that team atmosphere, again, as I was saying, it's got to be safe, okay? And where people feel like they have each other's back. That's critical when you're performing maintenance. You're looking out for somebody else because we all make mistakes. And if you've got that proper team aspect where you're looking out for your buddy and saying, hey, I don't think you did that right, it's got to be safe, right? For the person to offer that feedback and the other person to receive it. And that's where that psychological safety I thought I'd mentioned today comes in.
Thank you both very much for that. And that ties right into our next question. What role do aviation employers and organizations play in promoting mental well-being among their employees? What responsibilities do these organizations hold? To anyone?
Sure. Yeah, that's a really good question. And I think what you'll see across any organization is it always starts at the top. It starts with leadership, that's my role, and to really understand not only the landscape across America, but in our industry. So my role as aeromedical chairman at APA, we work really hard to do that, and I'll talk about some of the ways that we institute that. Today, speaking as the aeromedical chairman of the Coalition Airline Pilots Association, CAPA, we do a lot of our trade association work in Washington, D.C. So while we do the specifics of peer support through American Airlines, we also do the Washington, D.C. work to make this occupation stronger. So the role is leadership at every organization. Every organization wants to have high-performing operators. We all know that in safety-sensitive positions, our occupation is like really no other. So to have the support services, to have the really mechanisms at play that you can offer support are critical. Every organization has to use their systems methodology to get there. No organization wants to change a culture overnight, but they want to add to it. And so there's two ways we do it, obviously from the top down, but we also do it from the bottom up. I know our leadership team, we send them out and we say, look around the world, who does it the best? Look at other industries, what are they doing? Bring it back to APA and we're going to make it better. We're going to curve fit it to what we see our needs are, let alone our wants. And we're going to elevate everyone's game if we can. And I think symposiums like this, conferences talking about this from the university level all the way up to legacy airlines, everyone has their role. So those are just some of the few things that we're doing, but it all really starts with leadership.
Couldn't agree more. It starts with leadership. So raise your hand. Have you ever heard of someone named Brene Brown? Okay, good. So I'm going to paraphrase Brene here when we talk about leadership and reducing this stigma around seeking out mental health or behavioral health assistance. So she says something like, in our society, somehow we've equated success with the ability to go it alone, that we don't need help. We've got it all figured out. And as I think everybody knows, none of us has it all figured out. And she goes on to say that we've divided ourselves into those who provide care and those who need care. And the truth is, we are both. And so part of the reason I bring that up is part of reducing the stigma is to be open about the fact that us in leadership positions, I'm the top leader over there. And so I have to be open about how I think it's beneficial to seek mental health and behavioral health assistance when you need it, by being very open with many of my team members about how I have sought out behavioral health assistance from our therapist and why I did so. I think that's one of the ways we can model the behavior that we're seeking from others, to make sure that people feel like it's okay to ask for help. Everybody needs help once in a while.
I think from a trade association perspective for NBAA, it's really about promoting those best practices across the board, right? We're dealing with all sorts of different company cultures, and as you've heard, kind of these great leadership perspectives being offered is part of that. So some of it starts with that education piece, and then some of it really starts with laying out what are the best practices and the things that folks maybe aren't taking the time to learn or and that need to know as well too. So that's our approach here.
Yeah, thank you for that snapshot of kind of what the current mentality is. I think part of our role here today is to learn from all these industry folks. But I'm also curious, what are you looking for next? What's next in the aviation industry, when it comes to, mental health and behavioral health? What are we doing to push the needle forward and to make more change?
So from our perspective, part of that has been engaged in the aspects of policy, with the FAA and on the ARC, for example. Where can we go through and help streamline what may be some of those barriers that have prevented folks from seeking care going forward? Again, how do we educate and bring those resources to the community that help folks, increase that uptake of it and really see that improvement? Are some key pieces as well. So, we're in some ways earlier on in the process than, some of our peers in the industry and what they've built. So, we're trying to make sure we've got at least that starting point, and then we can further launch from there.
Yeah, it's a really good question. So we've looked at this very deeply, done an internal analysis, and so coming up this year, 121 years in aviation. I think it's important to realize that aviation, over the decades, we're going to lead in some regards and we're going to lag in some regards. So understanding where to make the pivot on a national level is critical. I know my colleague Mark next to me, looking at organizations like the NTSB, having their roundtable, bringing out to the landscape, following up with the FAA ARC, looking at the 24 recommendations, looking at the 7 barriers. These are describing the hurdles where aviation is pivoting to the societal norm. So it's critical to really understand what the landscape is. I can tell you at APA, what we did in July of 23, the DOT Office of Inspector General's report came out. It was a multi-year look at how the FAA qualifies medical recertification standards on this. We looked at that very closely. By the end of the week, we had developed a 20-member task force. Every part of our aeromedical committee are medical professionals, including one person from outside that. It was a 6-month project. And the project was all about how do we reduce stigma? How do we increase our effectiveness in peer support? Well, that was a 6-month project, and from a medical term, we unblinded the study after the first month, which means we didn't wait till the end of 6 months to institute these findings and recommendations. We did it the first month. And what we had found is we really sealed a lot of our knowledge gaps. We looked at ways where we can influence our own house to make it better, and then we share it with you, because every organization, you've got incredible, talented people that want to take the lead. Giving them the creative freedom to take charge in these type of projects makes a difference. So fast forward, we had a very big event in October of last year, and a lot more attention came to the industry about mental health. We felt well positioned. We had run this task force for months, and we're now sharing our findings across the industry. So everyone has a role, but especially at the organization level. And then lastly, I'll say, our collaboration with American Airlines is fantastic. Every part of every large organization is affected by this. So the more you collaborate with others, the more people realize that there is a shared benefit, huge value. It makes everything better in aviation.
Yeah, from a peer support volunteer program perspective, right? From a company culture perspective, what are the big progress things that have happened, and where do we need to go? Right? It's pretty simple: cultural buy-in, paradigm shift, trust, and time. Right? Those are really the ways that I look at it. How do we measure success? Right? How do we measure progress? How do we measure change? A lot of times, right? There's the government affairs, there's the regulatory side, right? That take change, but from an actual program perspective, as things mature, those are things that I think are critical and crucial, right? And so as peer support volunteer programs mature more on the air carrier side, continuing resources are phenomenal. Being able to get more resources, provide those to our crew members, but also just continuing to build upon that trust, having that paradigm shift, right? From we can't talk to anybody to we have a trusted resource that we can talk to. We have time to talk to them, and it's a non-judgment situation, right? Being able to go out on the flight line and mention that I'm with Hawk and have somebody be able to confidentially just come talk to me. That is a huge paradigm shift that we've seen recent in the last couple of years. Something I'm very proud of, and something that I want to continue on.
I mentioned leadership training earlier, and I think that the associations and industry partners have a big role to play potentially in that area. For instance, Michigan Business Aviation Association, we've started a series of leadership training events each March, and our third one is coming up this March, where we're going to talk about some emotional intelligence topics, like I mentioned before. The more we do that, the more we offer these folks the skills they need to do a little bit better in this area, will be a huge win for us. The second thing is that we try and do is create those opportunities for connections. When people feel alone or that they're on an island, they can start to feel overwhelmed and helpless. So we've been trying to create opportunities for people to come together and make relationships with their team members and other folks within the company, so they feel like they've got a network of support. And I think as an industry, we have an opportunity to create more of that feeling of connection. When folks have their phones out and they're just staring at their phones all the time, that can be one form of connection, but there are so many other forms of connections that we need to work on to be truly healthy individuals.
All right, so I'm going to pause there. Do we have any audience or Slido questions this morning? I know. Yes? Okay. Let you guys pass that. That's not what the question is.
Okay. First one is, have you published your mental health safety objectives in your safety policy? And do you measure the effectiveness of your risk mitigations?
It's a great question. So what do we publish? Well, I think we look at 3 steps. We look at awareness, education, and execution. So from an American Airlines pilot, I'm an American Airlines captain. From the first day you get hired at American Airlines, you're made aware of all our programs, right? So the awareness, what is the education, how they're used. So whether you're coming from buddies at the squadron, at flight training, at your flight university, everyone is, what I think is a fantastic part of the Part 141 community is you're being exposed to this. Resources exist at the 141 level, and they exist at the 121 level. So that awareness is huge. The education is how to use them. We make your life easy. When you come to American Airlines in-dock, we'll teach you about our programs, but we'll also give you this kind of fancy little refrigerator magnet. It's like a business card. But in this in-dock, you're with your spouse, partner, girlfriend, boyfriend, whatever it is. And so we tell you, a lot of times this magnet goes at home, so when one person is out flying and away from home and there's a crisis, you know where to call. So we like to use the marketing campaign is that, take our number, put it in your phone, speed dial, whatever. It's probably never going to be for you, but it's going to be for someone that you know, right? So that's how you really build a culture from within. So that's the public. As far as the second part of that, ask the question one more time. I want to make sure I can give you every part.
So that, have you published your mental health safety objectives and your safety policy? And do you measure the effectiveness of your risk mitigations?
We do. So for those of you in safety engineering and SMS systems, we use the 1990 Gleason model of the bow tie risk analysis. So we can add to that, but understanding that risk interpretation, we like to look at 4 stages. We like to look at latent risk, intrinsic risk, relative, and absolute. And so when you apply 1 peer support program is excellent, 2 or 3, that's phenomenal. When we apply all 7 of ours for risk mitigation strategies, let alone mental health professionals and medical professionals, because we know that a lot of these issues are comorbid. Some, they may have the deeper, we like to phrase it this way. We are completely aligned with the FAA when it comes to human performance. We support the concept that the deeper you get into the disease states, the deeper level of reoccurrence, the longer you may be out for work. And so we want to get in front of that. So risk mitigation, back at the end of 2022, we went from a reactive model to a preventative model. So we call it our continuity of care. From the first day at American Airlines to the last, we look at prevention, acute care, long-term chronic complex care, and recovery. So we add this risk matrix in there. Now, I think the better question is, how do you measure it, right? We call it the X factor. I'll use an example here. Everyone wants to be 100% when they go to work. If you drop down to 95 or 90, and you may be there for a period of time and you may not want to come forward, that's that 10% drop that isn't being measured. So what we like to do is we fill that gap, we bring you up to 100%, but it never really stops there, because when people realize that they're supported, they realize that all these benefits exist, they keep going to 105, 110, 110. So what we see is that X factor, that's really the risk, right? So if you're going to measure risk and reduce it, you should also start thinking about the metrics of how to measure performance and qualify it, because all these lead to higher levels of safety, and these are things that we look at carefully. But to measure it, it's a great question. We're continually trying to figure out exactly how to do it. We have ways, but they're not public at this time.
Okay. The next question is, do you allow time for technicians to visit or engage with mental health professionals or peers? Or is that done with PTO or off hours?
Sorry. He can be taught. So as far as when we allow for it, the mental health provider, mental health therapist, sorry, is available those 40 hours a week. Now, the person does not get reimbursed for time spent there. It's just a minimal charge for them. So if they go and spend an hour, that is on their time. But I think the beauty of what we're providing is it's just 2 floors up from the production hangars. And so it's very easy to use the resource, and it's a minimal charge, much lower, a fraction of what they would pay out in the marketplace.
Right. What is a good way for universities to bring up mental health issues to the industry from a student perspective?
I think getting us in front of the students as much as possible. I think we've had a few panels that we've put together during those March events that I mentioned, where we got to hear from the students directly, Western students, LCC students. And the last one we actually had some local high school aviation program students there, where they could tell us about what they're concerned about going into the industry. So I think those are great venues for that feedback.
To add that, I think what the FAA did last December when they put together a rulemaking committee, I think everyone has a role to play in that. So from the university level, having the engagement within the 141 system, through academia, through industry, having symposiums like this, having a consistent process flow, whether it's quarterly, having access to what everyone's talking about. We talk about working groups, task groups. They're all effective, right? They all have to have a finish line, right? How are we succeeding? Where's our progress? To measure your own organization against the landscape. Because aviation really is pivoting to societal norms right now. And you really want to be a part of that. Because at the end of the day, it really just gets down to human performance, safety, and keeping people at 100%. And the way we do that is with peer support, professional support. So it seems simplistic. In some ways it is on paper, but it's harder to do. You know, it really is. It's hard work. It takes a lot of dedication, but the rewards are phenomenal.
All right, I have a couple of questions that came in that are similar, okay? So I'm gonna try to bridge them. These two are asking about progress and change not being linear and taking time. And so how do you make room for obstacles, the setbacks, the adaptation to culture change, waiting for climate and culture to catch up? How do you, in the process of moving the needle, right? How do you accommodate or create capacity or create room for all of the bumps you're going to experience as you are trying to get there?
I'm working on that training piece here. It's pretty simple. You make room for it, right? There's no other option. There's no other choice. It's just that simple, right? From a peer support volunteer program, right? We have a situation or scenario that arises that we've never seen before. You have two options, right? You either make time for it and you adapt to it and you take care of it because that's the best interest of that individual, or you don't, which I don't think anybody's okay with in this room. So it's pretty simple, right? And from a perspective of how do we embrace it? That's a cultural buy-in again, right? We've talked about it. When it comes to having somebody from the lowest level of somebody calling you and you guys talking, and you get to that point where they no longer need that conversation. That's progress, right? To something bigger where we may have to get our professionals involved. We have those resources, we have the capacity, we have the culture. There truly, I don't think, has been a situation where we can't adapt, embrace, or take care of it.
I'm going to add to what Jeff said. So we have a methodology that we call R to O to R, research to operations, operations back to research. Essentially the OODA loop for those military background, or just a feedback loop. So really what we're doing is we're assigning certain people within our aeromedical committee to really evaluate what each group is doing, right? Are you doing the best you can? Are they monthly meetings? Are there constant re-education programs? I can tell you in our peer support, we're very lucky. Not only do we have different types of training, but every month we do a grand rounds. We talk about cases, no names, everything's de-identified, of course. But we talk about the case structure, how to handle that. And overseeing us is a 30-year veteran, a neuroclinical psychologist. So every month we're getting training. For the professionals in the room, this is like CMEs. You may get up to 20, 30 CMEs. Plus we have access to other professional articles, Psychology Today articles. It's all on our website. Because we want to empower our volunteers to be exactly, let's just say we want to educate them. And another force multiplier that we have done, which I think every organization should do, is we have cross-training. And every single part of our 7 different departments is cross-trained in another function or another. That has brought higher levels of efficacy, better efficiencies, and better case handling. Because at the end of the day, handling the cases, being available, is really the most important part. So from our peer support, we have 2 individuals, 24/7 coverage on the hotline. Difficult cases, they get triaged up to our 5 or 6 leadership positions where they look at different case handlings. They have lots of experience. And then they work with our professionals to mitigate a plan and to help those individuals with the most support that we can. So kind of a multi-level triage process, access to information, and really understanding that every single, in our case, our subcommittees really can evaluate what's working, what's not. And we want them to be out front, and we give them the opportunity to really say, hey, this is not working. Or you know what, maybe we didn't handle this properly, let's do it better. So really that open communication. And I'd like to say, even though we're probably the biggest airline in the world, biggest independent union in the world, some of the smaller groups, actually, you have a huge advantage because you're not a big ship. You can take off right away and you might have a cohesive patchwork within your organization that's actually very effective. So whether you have 200, 2,000, or 17,000, you'd be surprised how much ground you can cover even in a month.
Go ahead. You just brought up something that started in my mind. So when we talk about peer support, right, we're not a small organization by any means, right? I think we have 3,500 on our roster as far as crew members, but adaptability, right? You talked about the adaptability. Diversity comes to mind, right? And the conversation of having that bench. We always talk about how deep our bench is. That's another thing. So with the recent hiring, we have very wide, varying age demographic, cultural backgrounds, all those things, right? And so something that we have built in within our peer support volunteer, and something maybe to take a peek at, is we call it common experiences. So what has happened in my background? What has occurred in my life? What are topics and things that I'm okay with talking about or helping through, versus those that may not have as much understanding, empathetic, or empathy, or just relation to those topics. So something that you can maybe look at building into your programs as well.
Part of the question was, how do you know if you're making progress? Well, for our situation, our provider is employed by an organization, not Duncan Aviation, so they have a presence there. But the beauty of that situation is every month, myself and other leaders within the company get a set of data. Now, there's no patient names, there's no diagnoses, so it's all very confidential. However, we see the raw data, so we know about utilization of the clinic for behavioral health, and we know about who's making, not who, but if folks are making progress. For those who are familiar with this, there's a depression scale and an anxiety scale. And so something that happens every visit with a therapist typically is you get rated on those scales. And so you can tell from visit to visit, is someone making progress? So we get reports on that. Are people in general making progress, and how much progress? So that's the data side of it. There's also the anecdotal side of it. I know less scientific, but when somebody, and this happened to me a couple weeks ago, and I'm walking through the hangar and they flag me down, somebody I've known for a while, and he says, "Andy, I gotta tell you, that therapist you got, she's awesome. She's helping me so much in just a few visits. I can't wait to keep getting back to her." So that makes you feel good, like you're doing something right. It's just a couple people's feedback, but it's all positive.
I have a couple of peer support questions, but before I get into those, I just want to really quick follow up around the culture change. If somebody could just very quickly, how long do you anticipate for culture changing and climate changing to happen within your orgs? Like, we're in a very right now society, and this takes some time. So when you're thinking about your goals and what you're doing, how long do you allow or anticipate for shift?
It's a great question. So I think when I look at the question, you can look at, when you talk about culture change, you can start with and use comparatives, right? We talk about the 1964 Civil Rights Act in America. We talk about every decade what the progress has been. That's the benchmark to measure. We can talk about the first ever NTSB mental health roundtable that was December of 2023, the FAA ARC as well. So now we're almost a year progress. What have we seen, right? What organization structures have happened? So from an individual point of view, how you're measuring change is really micro and macro. Micro, what is your organization doing? What are the particular people within the organization? Are they being heard? Are they developing strategies? Are they using methodologies that work? Macro level, we know the changes. We see what's happening. So there's a lot of momentum. So a little bit has to do with how you're measuring it. And I think it really starts on the micro level first, because on a nationally, the perception is that we're doing everything right and it's not working. But that really may not tell the story. So I think you have to look at it in a couple different ways. We've seen phenomenal change in the last 12 months, but we're heavily engaged, so we follow the progress. If you're new to this subject, you're probably trying to figure out, where do we start? How do I measure my own progress? So it really starts with the baseline of where you're coming from. But as far as like the predictive analytics of where I see us in 12 months, I think the society and the numbers are coming more front and center. We'll take a step back from the 60s and 70s. There was a time where people said, oh, if you had heart disease, well, maybe you're less than, or maybe that's scary. But we talk about heart health, brain health, mental health. It's all the same to us. Now, from a perspective of how we look at our APA members, we just look at it holistically. It doesn't matter if it's mental, physical, emotional, spiritual, it's all the same. It doesn't matter. And when you speak like that, when you articulate exactly what the need is, everyone gets it. So change happens faster when the messaging is crystal clear.
Yeah, if I can kind of pick up on that too, maybe I'll draw a parallel more broadly to safety, right? I mean, so, as I think about my 20 years at NBAA now, we were much earlier on in safety management systems, for example, within business aviation. We had, those early adopter organizations that were ready to kind of pick up the mantle and really step up to that plate and see that constant performance evolution and improvement. So, and Rondeau kind of touched on this too, is that, every organization is going to kind of be at their own pace. So it's hard to sort of say, a given organization's culture, how long it's going to take, maybe to take a half step back to maybe the prior question there too, is I think some of it depends on that engagement, as we kind of talked about. Bringing this back to the kind of mental health conversation, I would say, having done a lot of policy work over the last decade and a half, that this is an issue that is certainly moving, I would say, much faster than we've seen with other policy initiatives moving the FAA forward and the industry forward. So I appreciate that perspective and certainly happy to see that in this case. But I think it's a matter of where that drive, that engagement is, and certainly hoping to see a lot more and continue the faster pace of progress in this to move forward. Thanks. Anybody else? Oh, go ahead. Off. Cycle.
Oh, there it goes. Okay. Can you respond to the critique that peer support is a Band-Aid trying to fix a problem caused by systemic barriers to traditional healthcare access?
It's a really good question, right? So now we're talking about how to measure the effectiveness of an organization, right? We know that case-specific details. We like to look at it as this. So back in late 2022, we looked closely at similar questions, and what we did is we went from reactive to prevention. And so now when you offer the skills and you offer the tools and you make your websites very accessible to more resources, and you start to change the landscape, so we're throwing yourself into a system where it says, fix me, Band-Aid, maybe to understanding all the steps that are needed, prevention, to look at root cause issues. And so we like to tell our members is that when you go into the medical system, remember, you might be a professional pilot one day and turn into a professional patient, but don't throw yourself in there, right? Be the CEO. Use your aviation mindset, methodology, and your systematic way to get things done, right? You're going to be your own best advocate. We'll be there right by your side. So when it comes to systematic change or cultural influences, I think there's probably two parts. I think there's the term we like to use is shared responsibility, self-accountability, right? Every organization takes their place. Collaboration is great, no matter what industries you're working in. And then you can do more than you think. But it really starts awareness, education to execution. Great question.
I don't think peer support's a Band-Aid. It may be seen by that, like that, but the way I think about it, it's part of a system of support. Because yes, traditional medical care, healthcare has a role for sure, absolutely. But are they accessible as they should be? No, they're not for everybody, whether it's time or money. They're not as accessible as they probably should be. At the same time, we have an opportunity as employers to fill that gap, and that's what we've done. It's come up by almost everybody on the panel, I think. We've all taken those steps to fill those gaps and make it more accessible. Most of our team members who are full-time spend more time at work than their waking hours at work than anywhere else. Because of that, not only do we have the opportunity, we also have the obligation to provide that service, that safe space. In fact, with all the stressors in life outside of aviation, the workplace might be the only safe place these folks have in their lives. And so we have to see that as an opportunity, not as a Band-Aid. We've got them. We can help. We can be part of the solution.
I'm going to add that just a little bit. I know we're talking about the university level, but I'll share what I think peer supports have been very popular. And it's probably not spoken of that much, but if you're 35 and you have 2 kids under 5, or if you're 55 and you have 2 kids in college, what peer support programs don't have is they don't have co-pays. They don't have to worry about parking or valet parking. They don't have to worry about calling someone to schedule a visit. They don't have to worry about where am I going to drop the kids off to go talk to somebody, right? We answer the phone every time, 24/7. And when we have a culture that says, hey, it's okay to reach out, that becomes very popular. People like that. People are living in a nanosecond world where they want things done quickly. And the expectations are higher than they were 10 years ago, technology driven. And so you have to adapt as an organization. So I think it has to do with perception. I think peer supports always have their role. I think the data is still to be collected. But I think as it transforms, all we have right now is anecdotal information. But like all science-driven research, it starts in the clinic and works its way out to the lab.
If I can add to this question here too, right? I think, as was kind of shared, I think this is part of that overall suite of options that makes sense, right? How do we address the access issues and the timeline with that, whether it's the nature of the immediate phone call or wanting to talk to someone soon, but also what's that expertise of the person and what's the issue that an individual person is working with and dealing with. So where we talked about peer support from a business aviation standpoint, part of what we're trying to build in is making sure that mental health provider professional support is there, in concert with the program when something may need to actually be escalated. That's a key piece in a peer support program, as I understand it. But as I shared at the NTSB event as well too, if someone wants to go direct to that mental health provider support, I think the policies should support that without adding a whole lot of extra red tape in there as well.
I'll just finish it up real quick. So crew members, do we live in the same place we work? Typically not, right? We're nomadic. We're all over the US, we're worldwide, wherever we are. So regardless of that thought process, right? When you're in a hotel room on day 3 of a trip or 4 of a trip and you get a phone call that there was some family matter that's going on, or and a lot of times it's you're supporting maybe others, and your tank is empty, right? You need somebody there. Having that common direction to go to, there's a target. We can push the button. We can make the phone call. Doesn't matter where you are, right? It's like that SOS satellite system, right? We know where you're at. We're going to come get you. That's a huge benefit, and it helps our crew members.
Okay, I think we have time for maybe a couple more. What specific steps should be taken to establish peer-to-peer support systems within an aviation program? So what steps do we take?
Okay, I'll jump on that. So specific steps. Interest at the student level, interest at the leadership level, right? That'd be number 1. Shared interest, collaborative efforts. Do we want to do this? Who else has done it before us? What's the support? We talk about universities like Western Michigan, UND, Auburn, Middle Tennessee State, right? How are they progressing? Those shared ideas. That's a good start. For the university pilots in the room, I was one of you, like when the dinosaurs walked. So things have changed. This topic was like not even on the radar. It wasn't. Neither was GPS, so I'm aging myself. So I think you have to really look at the landscape of what's possible. When I look at the next generation, it's just phenomenal what's out there. So I think if there's a will, there's a way. And you have so much momentum across the landscape right now in America to make this happen. So I would guess.
So we have been very fortunate to see the results and the fruits of the labor that have come before us from the collegiate industry. We are now obviously bringing on crew members that have seen these programs before, right? And it has been a wonderful thing to hear, oh, hey, I had that back at, here or there, insert university. That's phenomenal, right? Because it creates a continuity, creates a cultural buy-in before we even say hello to you for the first time. So absolutely huge. So having that leadership buy-in at your particular level and having them understand that, we're using it at the majors, right? The legacies, we're using it. It's there, it's here, and we absolutely believe in it. Do with that what you will. So pretty nice. The other thing, just kind of as an aside on that, is we have also seen the opportunity to implement, and what we're really proud of, we call it our mentorship program. And so we now have also, we want to bridge, right? Going from that full-time student to, out on your own full-time crew member for an airline can be a really overwhelming thing sometimes. So we have a mentorship program that we put in place. So every single crew member gets assigned a mentor for that entire first year. So if you have a question, you have a comment, you need some help, hey, I don't know how to do this, I don't know how to do that, we are there for you. And it's a text, it's a phone call, it's an email, it's a however you want to get in contact with your mentor, right? Because there's so many resources out there. And I think you do that as a really good job at the collegiate level when you're in the same space, right? But we've seen that when we get to more of that nomadic, where we're all over the U.S., we may be a little more fragmented, and we want to have that continuity. So, and in that conversation, if they say, hey, may want to go talk to the peer support volunteers, we're there for them as well. So.
All right, we have time for one more question. And this was probably the most popular for Slido, this panel. We have quite a few questions. So I know some of your questions are not getting answered right now because we're going to run out of time. But during the breakout session, during the lunch period, I would encourage that we bring these questions, the ones that we didn't get to, into that session. So the last question for today, we're going to navigate away from peer support. What are your priorities working in Washington, D.C. to further pilot, and I would say aviation mental health?
Yeah. So from my perspective, priorities in working this in DC, where can we reduce those barriers that are keeping people from getting the healthcare that they need first and foremost, right? I mean, let's take care of our people. Where are the things that hold up and add to the timeline as a real concern or consideration? That definitely comes up a lot in the conversations, both from the individual being away from work, which is part of that stability in their life, let's just say, around this, certainly from the financial barriers as well, and then from the employer in terms of having that engagement of their employee on the flight line or on the shop floor, wherever that may be, as a key piece. So that's where I think a lot of our focus has been. Are there a lot of ways we could get there and things that help do that and cut down, whether that's the testing that's required to get to ultimately a yes by the FAA, whether that's the paperwork, whatever else, we're happy to kind of explore any of those options and see what helps us, see that in a way forward that still ensures that we're going to have safe flight operations and safe maintenance and everything else as well too.
From a Catholic aeromedical position, a lot of the work that we want to bring forward is we look very closely at legislation that's coming from Capitol Hill. We go through it. We want to make sure that it's really aligned with industry's best. We look at the FAA ARC. This is the Mental Health Clearances Aviation Rulemaking Committee. So when we start to look at mental health, for the doctors in the room, we know that the different level of disease states, the reoccurrence, the comorbid conditions. When you leave work, getting recertified to come back to work, what are the mechanisms to keep you at work? So now we're looking at from recommendations 1 and 3 from peer support, recommendations 13, 15, and 16. Now we're merging, we're starting to look at mental health, physical health, and the systems. For the doctors in the room, your EPIC systems, your EMR, electronic medical records, right? The speed of accuracy to get people where they need to go. Treatment plans, back to work, medical recertification. So understanding the needs of the FAA, understanding the needs of the industry, and for our profession in general. So those are really some of the efforts that we do in Washington, D.C. What's the outcome? It's win-win, right? It's really win-win. Aviation has learned how to adapt and evolve with technology, other regulations to meet those needs, and that's our role at CAPA in Washington, D.C. Great question.
Wow, those are some amazing questions. Thank you all for that participation. I know it's hard. It's 9:30 a.m. when we started this, which I know I hated 9 a.m. classes, but now I start work at 9 a.m. Thank you all for those awesome questions. I know we didn't get to all of them, and I know these panelists have much more insight to share. Please feel free to come find the panelists, talk to them. I know they would be happy to discuss more about what they're doing, learn about your questions, any insight. I know we're learning about students later, so I'd encourage our panelists, hang out, ask the same questions to our students. I think they'd have some different answers, and I'm very curious to learn from them as well. So thank you for being such a great audience. Thank you to our panelists for being here today. We appreciate your time.